Well, first of all, welcome to everyone. My name is Rick Bauer. I'm on the executive committee of PallCHASE, Palliative Care in Humanitarian Situations. It is a delight to be here and to host this 5th webinar in our series, Communication, Storytelling, and Experience on the Margins, Journey of Understanding for Humanitarian Palliative Care. And for this webinar, because it's been in the news and our work, we are going to focus on some great colleagues working in the Ukraine. And so it is a delight to be here. We will have 3 speakers, some panel discussions, but absolutely inviting you at the end to join us with questions and good discussion. And so without further ado, our first speaker is Dr. Marta Salek, is a current pediatric hematology oncology fellow at St. Jude's Children's Research Hospital. Originally from Waterloo, Ontario, Canada, she completed her graduate degree in Canada before studying medicine at the Jagiellonian University, and I did not pronounce that right, in Krakow, Poland. She completed a pediatrics residency at the University of Massachusetts Bay State and went on to complete a palliative and hospice medicine fellowship at the University of Washington Seattle Children's Hospital prior to her move to St. Jude's. Dr. Salek's research lies at the intersection of oncology, palliative care, and global pediatric medicine, and centers on optimizing care and quality of life for children with cancer on a global scale. Since the end of February, Dr. Salek has been on the ground in Poland, supporting the St. Jude Safer Ukraine initiative. The goal of this initiative is to assist with the transition of patients diagnosed with cancer, blood disorders, or catastrophic illness and their families out of Ukraine to physical safety and assure continuity of high quality medical care. And so without further ado, I invite Dr. Marta Salek. The floor is yours. Thank you.
Thank you so much for that lovely introduction, Rick. I really appreciate it. And I apologize for any background noise that there might be here where I'm at. I actually might move. I'm so sorry. As you know, humanitarian work is just constantly on the go. So as was introduced, I'm supporting the Safer Ukraine initiative for St. Jude Global. And SAFER stands for Supporting Action for Emergency Response in Ukraine. I'm currently on the ground in Poland, and I have been since the end of February. I was in Poland coincidentally visiting family. I'm both Polish and Canadian, and so I can speak Polish fluently. And when the war broke out, I was asked by my colleagues at St. Jude Global. I'm so sorry. Okay. Stop, Sean. I'm so sorry. So when I started when I was asked and approached at the start of the war to assist with the efforts because I spoke Polish and it was convenient that I was already here in Poland. So St. Jude Global, as you know, is a department within St. Jude Children's Research Hospital in Memphis, Tennessee. And the global department was started in 2018. And one of the goals is to create an alliance globally to help improve the outcomes of children with cancer. Part of the St. Jude Global Alliance is that we had built relationships within the Eurasia region, which included partners in Ukraine and in Poland. And those partners were both medical providers, but also foundation partners. And so when the war broke out, initial conversations had happened with our partners in Ukraine and in Poland, and there was obviously stress and a need to act. And so based on the needs that were identified by the Ukrainian partners, both physician and foundation, the Polish Society of Pediatric Oncology and Hematology with St. Jude jumped into action, and also with collaboration with PSYOP and CCI. And so from there, we decided that we were going to try to help evacuate children with cancer, blood disorders, and catastrophic illness from Ukraine safely to Poland and now further abroad. And so the way our system works is that we have a hotline established in Ukraine and in Poland, as some families will need help within Ukraine and others will travel independently to Poland to seek care. And they contact our hotlines in Poland and Ukraine, which are available in several languages, but most importantly in Ukrainian, as these patients and families often only speak Ukrainian and sometimes have some Russian language knowledge, but of course, in these times, they prefer not to admit or to use the Russian language. When we get their information over the hotline, we obtain just basic demographic information, including number of family members traveling, their diagnosis, what their needs are. And then we also ask for pictures of the discharge summary from the hospital or any medical records they have. And this is important because we have established over 200 volunteers who can translate documents from Ukrainian to English. And these volunteers are present from all over the world. We then established a centralized registry of patient information, which is now approaching 1,000 patients. And from here, we work with our partners in Ukraine to arrange either triage in Lviv at the West Ukrainian Specialized Children's Medical Center, or if the family chose to drive to the border on their own, we also supported them in that way and directed them initially to the Polish clinics or to other neighboring countries such as Moldova and Romania, depending on where they were geographically in the country. This process grew day to day, and at one point we realized that there was a saturation point for the Polish medical system in terms of number of patients they could safely take care of, in addition to the normal expected cancer patient population in Poland from year to year. And from that point, we decided to create a triage center in southern Poland that we named the Unicorn Mariya and Vynnytska Clinic, which is located in southern Poland, central to several different international airports, because we are hoping to send patients to different geographic centers in Europe, where there are many people who are volunteering to take patients and to cover the costs of their care. And so through this triage center, we only take stable patients. Any unstable patient is taken to a hospital in Poland. And if they're stable, once they're stabilized, they either stay in Poland or get triaged further to Unicorn or to another international center. And then we have sent them by air or by ground transport all over Europe, to Canada, and also to the United States. When we ask, we not only ask for care of the cancer care within these countries, but also the care of the entire family, psychosocial complete care, as these families obviously are going through not only the traumas of having a child diagnosed with cancer, but also the traumas of having experienced war. And so really, I think that this initiative was only able to occur so quickly because we had established very safe and trusting relationships with our partners ahead of the war. And so when the war broke out, we were able to jump into action very quickly. Some of the challenges that occurred, as you can imagine, challenges occurred at every step, and we had to adapt and quickly grow, and there was honest and transparent communication between each group. And each silo, whether it was in Ukraine, in Poland, or abroad, we all tried to protect one another. So for example, the stresses that were ongoing in Poland, we wouldn't relay that stress to our partners in Ukraine because they were already undergoing so much stress on their own. And we always committed to taking their concerns and needs very seriously and prioritize that in patient care above all else. Some of the other challenges were some of the trust and psychosocial challenges when the families came to us. We try to mitigate that by having Ukrainian team members employed at the Unicorn Clinic. And so we have a child life specialist from PallCHASE Foundation, which is a foundation we have that we work with in Ukraine. So we have Ukrainian speakers also who work at our clinic and help liaison directly with the patients and families. We realized that these families were really nervous. Even at some point, they were worried to come to Unicorn Clinic because they were worried we were going to perform surgery and take their organs from them for the organ trade. And there was a lot of misinformation among families about what we were trying to do. And so we're trying to upstream mitigate some of that distrust and misinformation even in Ukraine now, and trying to really communicate that this is a safe option if the families are not available. We also had trouble with transport in terms of transporting patients within Ukraine and abroad. And this was mitigated by asking countries who are accepting patients to provide all transport. We also had some trouble in terms of how to build a humanitarian response and the skills that are needed. And I'm so sorry for the noise. So for example, my skill set is very limited to that of a physician and to that of a palliative care doctor and an oncology trainee. But to create a logistical platform like this, you really need skill sets that are above and beyond what I had learned. Obviously, I'm not the only person on our team, but one thing that I've learned is that it's important to think about the traits and characteristics of others. And so, for example, we had FedEx help with logistics and sent two people on the ground to our team to help with inbound and outbound logistics. And so for me, as a medical trainee, it was fascinating to learn the skill set of another industry and see how much it can help in the humanitarian response and to not only improve our workflow, but above all else, make sure that our patients are safe. We also had challenges of resources. For example, the amount of refugees in Poland is now overwhelming. The Polish people have been so generous. And so lack of accommodations for patients and families has been challenging as the war continues to go on, given the amount of refugees that continue to travel through Poland. When we looked for a clinic for the triage center, we needed to find a place with individual rooms that wasn't already occupied by refugees so that we could maintain the safety of our patients. But of course, we didn't realize that some places might not have internet or phone. So even logistically, we had to install that. And so now I know a lot about installing internet, which was fascinating skills. There are also some legal challenges. So for example, in Ukrainian, the words for asylum and refugee are very similar, but have very different implications. And so when patients were traveling and families were traveling across the border and were asked to take refugee status, some interpreted this as asylum, but of course, even having to the simple fact of having to take a refugee status has social implications and is very traumatizing in itself for the patient and family, especially when there's generational history and generational memory of war in recent times. And then in terms of palliative care challenges, we've encountered a number of them. For example, patients who've been identified as palliative patients or patients who have no curative therapies available in Ukraine seek a second opinion now abroad. But what happens to the families when there is no further therapy in a country other than Ukraine? And so now we have challenges because these families are now supposed to trust medical providers in different countries who speak different languages, who are telling them that there's nothing left. And so some of these families now want to go back to Ukraine. And in a system where the primary care system has essentially been demolished and is very difficult, especially in regions that are further east, how do we provide palliative care for the families that do want to go back? How do we provide symptom management and end-of-life care? And so these are all really big challenges to think about, not even just from the medical aspect, but from the transport. So currently we have families that are being transported with everything free of cost to different countries, and that return place home. The logistics of transport home has not been established, even though we promised it is a different additional logistical challenge to transport families. If the child's symptomatic, do we transfer them to a Polish hospital first, then arrange transport to Lviv and then further on? But all of these things have to be done case by case because the challenges are all so patient dependent and dependent on the needs of the patient and family. This is also additionally challenging as men who are between 18 and 60 are not allowed to leave the country. And so if you have families or children who have relapse disease or need intensive therapy or have transition of care, they might not be around the family members who are most important to them. And these are all the trauma and side effects of war. Many are conflicted about what to do and where to go. Many have trouble communicating with their healthcare providers, and so end up communicating with their trusted physicians and psychosocial providers in Ukraine, who then tell us, hey, this patient in this country, in this city is having trouble with this, can you help? And so we do a lot of triaging and liaisoning between patients and families. And then we also think about the access of medications in Ukraine, which has obviously been disrupted, and how do we procure medications that are needed for good symptom management and pain control. And fortunately, the Polish government has been helpful in terms of ensuring safe pathways of transport of these medications from Poland to Ukraine and then further on. But making sure that we know what the needs are of the doctors is another challenge, especially for the medications that are restricted, such as chemotherapy and opiates or other pain medications. And then the other aspect is just how to manage end of life for a patient and family that stays, who stays abroad from Ukraine, and just the different cultural nuances that are unique to the Ukrainian perspective. Thank you very much for your time, and I'm so excited to be able to present this work to this group, because I think it'll be necessary to have many collective minds to think through how to approach these challenges in a culturally sensitive way, and definitely in the near future, but in the several months ahead. Thank you very much.
And Marta, thank you. I'm personally just overwhelmed at hearing, the incredible story that you've just shared with us. And I have a million questions, and I think we're going to go with the other speakers. But I'm just so struck by, in palliative care, we always talk about the team, and how in this situation, team has just expanded, and logistics and internet providers and all of those people to make it work, that we take our charism of working as a team now into this situation. So thank you for what you're doing. It is now my pleasure to introduce Mariya Vynnytska. Mariya is a psychologist working in Kiev as part of the team for the Soul, which reaches out to those needing counseling, emotional support due to the trauma of war in Ukraine. She is qualified in law and journalism, is an excellent translator, a trainer, a pianist, and her outstanding communication skills keep many informed of what is happening in the Ukraine through her social media platforms. And so, Mariya, welcome. And again, thank you so much for being here.
Thank you, Rick, and thanks, John, again for the invitation and for the opportunity to be here with you. And I have a couple of slides, and I think Anne is going to help me with them. So today I'm here on behalf of my team, representing the Psychology Center, The Soul. And in my presentation, I would like to touch upon some psychosocial aspects of the war, what we have encountered as counselors, as psychologists, and maybe also to share a couple of nuances in general about the context, what's happening in Ukraine now, so you can also get a better feel of the needs of your patients. Next slide, please. So as I've said, I'm here on behalf of my team, and this is who we are. We're a group of 4 psychologists, and we have a manager. She's unfortunately not on the photo, but she's with us and she keeps us on our toes. So we're a relatively small team, and we've been working together for more than a year, and we represent different modalities: psychoanalytic school, gestalt therapy, systemic constellations work, some body work, and our motto and our desire was, and the wonderful blonde lady Alexandra, she's the one who brought us together in the team, and she said that, listen, sometimes clinicians and practitioners, they're a bit possessive about their own modality, and they don't like other people to let into their psychoanalytic group or gestalt therapist group. Why don't we create something where we can learn from each other and share our knowledge? So that's why we represent different modalities, and we want to keep it as part of our essence, and we want to welcome other practitioners if some people would like to join us in the future. So we all have our individual practices, we have our individual clients, and when we started working together, we came up with several formats of activities, some work that we could do together. we were running some workshops. We were having some psychological picnics, as we call them. We would organize some meetups in the coffee shops for people who wanted to speak about relationship or about career choices, about professional development. So we're doing different kinds of, I would say, like normal activities before the war, playing with different formats, piloting different ideas. And this is also part of our essence. We like to experiment. We like to try something, see, oh, that works. Okay, that doesn't work. Let's try something else. So we're doing work with individuals. We're running some group workshops. We're working offline and online, but after the war, basically all our activities have moved into online format. Next slide, please. So a couple of facts about Ukraine. I'm sure that you've heard a lot about our country recently, but maybe just several aspects I wanted to mention. That Ukraine is the second largest country by area in Europe, with a population over 40 million people. Ukraine has the first place in terms of the arable land area, and Ukraine is often called and has been often called in the 20th century the breadbasket of Europe. Our soil is really very nutritional, and maybe you've heard about some stories when Germans were taking actually the soil from Ukraine and transporting it to Germany because of it was really very fertile. Also interesting fact that Ukraine, I don't know, maybe there was a constitution before Ukrainian constitution, but we like to say that the first constitution in the world was written and adopted in Ukraine in 1710 by a Cossack hetman named Philip Orlik. And in general, this whole idea of freedom and fighting for freedom, I think it's been in our blood for centuries and for generations. And I think this is something that is also developing now even more. And Ukraine has many well-educated people. We have lots of professors, universities. So I think in general, Ukrainians are very intellectual and always like to learn something. Next slide, please. A couple of facts about the war. So the war officially started on February 24th in 2022. I was here and in my apartment in Kiev, and I'm still here, and I took a decision that I'm gonna stay. So I've been here from day one of the war, and basically it started at 5 a.m. when the first missile hit the residential building in Kiev, in the capital of Ukraine. And from that day, it's been a nightmare, frankly speaking. So today is, I think, the 56th day of the war, and unfortunately, as we've realized, that the war doesn't have weekends, it doesn't have holidays. So this is like every day, some really dramatic and tragic things are happening in Ukraine. This is an absolutely unprecedented scale of what's happening. In Ukraine, we do think that it would not be an exaggeration if we say that this is genocide. It has a legal definition, and we see everything that is part of genocide being done by Russia now in Ukraine and with Ukrainian people and to Ukrainian people. So what this war has caused, which has been happening for about 2 months, the biggest migration crisis in Europe since World War II. There are some data from UN websites that I've collected yesterday that more than 4.3 million people have fled Ukraine, and more than 7.1 million are internally displaced already. And the numbers are just crazy. And every second that passes, a Ukrainian child becomes a refugee. So this war has caused a huge humanitarian crisis. We have seen countless war crimes, war atrocities, mass murders, rapes, torture, and lots of deaths of civilians. So this is not like a local military operation, which is happening in very segregated area. This is something that is happening across the whole country. yes, different parts of the country are affected differently, and we understand that war is very dynamic process. So things are changing. The troops have been more in Kiev and Chernihiv area a few weeks ago. Fortunately, now they are not around this area, but now lots of troops are in the east and in the south. So just for you to understand that the situation in different parts of the country is really very, very different. Some places and cities are still look pretty normal and safe, relatively safe, while other places are destroyed almost like to the degree of 80 or 90%, like no towns left, no infrastructure, no people. So right now there is, frankly speaking, no safe place in Ukraine. Next slide, please. My colleague and I, this morning, we had a chance to speak with my partner, Alexandra, and we were thinking, because we were communicating with John, and I knew that I would have an opportunity to be part of your palliative care meeting, and we were thinking, what do we share, and how can we also speak about something that you will be able to relate to, and that maybe we were looking for some topics around which we can combine our efforts, like psychologists, counselors, social workers, and palliative care specialists. And Alexandra and I thought that we would speak about the losses in general, what people lose right now. And we structured our presentation in 3 parts. We wanted to say a couple of things about what do people lose now, how do people cope with it and deal with it, or can't cope, and what can help maybe, and explore some opportunities and avenues for our cooperation. Next, please. So what do we lose now? Say we, what do Ukrainians lose now? And we as psychologists look at it from two angles, from at the tangibles and intangibles. Naturally, people lose their lives now. A lot of people have already tragedies in their families. They lost their loved ones, grandparents, parents, brothers, sisters, people got killed in the war. People, so lives is the most important, naturally. And actually, even the way people lose their lives is very different. And we were discussing with our colleagues the other day that how would you prefer to die, actually? And we've realized that we would rather have it, we would be happy if it can happen quickly. But thinking about that someone can come into your apartment, can rape you and torture you for 5 hours, this is really a very different story about death. So death is happening very differently to different people now. People lose their homes. People lose all their familiar things, all their belongings, all their surrounding. They lose their everyday activities. Their kids lose their schools. People lose their jobs a lot, their businesses. They lose their favorite places where they used to go, and places for hobbies, for leisure. And speaking about the intangibles, people lose their hopes. Many people lost faith. People lose their dreams. They lose their goals. They lose their sense of at least some control over their lives, a sense of authority, a sense of power, a sense of that they can do something. Because a lot of people have experienced this unbearable feeling of being helpless. And all these tangible and intangible things that people lose, they actually are a huge part of our identity. So a lot of people with all these cumulative losses, they basically lose their own sense of self, their own identity. Many people ask themselves now, who am I? I don't have a job, I don't have a home, I lost my loved one, or so just one loss on its own can trigger a lot of thinking in terms of who am I now. And now people are experiencing a lot of losses and see a lot of losses around them. So the scale and the volume and the intensity, it's going to the core, to the deepest parts of human being right now. Next, please. So how do people cope with the losses? And I've mentioned this morning, and I'm sure that people in palliative care know very well all the stages people are going through in terms of accepting their diagnosis, or the diagnosis of their child or a loved one. So we know this phases. Yeah, like first we reject, we're going to denial, then we try to bargain, and many people are experiencing all these things that that we know about in theory, but now we're also experiencing these things in practice ourselves. So some people are still in denial, some people are still bargaining. A lot of people are experiencing very intense anger, hatred, and rage. And I mentioned this morning that it's not, first of all, we don't say that any feeling is bad, and hatred is not bad. It's just a feeling, and rage is also not bad. And this anger, rage, and hatred, to some extent, it is helpful right now because people do have to fight. So this can be used by people as a fuel, basically, to do something, to either to fight literally if they are in the military service, or just to be active. But from the other hand, this anger and rage is eating people from within. Many people also have never thought about themselves as someone who can hate so much, because I'm also in this crowd, and we hear it from our clients, we hear it from our friends, like, can there be a limit to hatred? Can there be a limit to this rage? Because what's happening is just, there are so many war crimes. We see so many horrible things on the news every day that it's just overwhelming, this anger. And underneath this anger and rage, actually, if we go deeper, very often it's a huge sense of, it's huge vulnerability. And again, that sense of helplessness and being unable to do a lot. So, and there is fear and vulnerability. And depending on what people have experienced already, and definitely everyone is unique, so people are responding differently to this whole situation. Some people are still in paralysis, some people got hyperactive, some people got frozen, so the response from people is different psychologically. But some people are already in the kind of like a grieving phase, understanding that there will never be life as it was before. They have already lost something. They already experienced the sadness and the pain of the loss. And actually, it's not bad, because at least people are in touch with the reality. They're not denying, but the pain sometimes is just overwhelming because of the losses. And we also understand that like the ideal final phase that we should all come to at some point is accepting what is. And sometimes we get there, sometimes we don't. And I think we all know that these phases, they're not linear, they're not happening like in a very strict sequence, like this phase, then we're going, oh no, we're like anger, okay, then there will be grief, and then we will accept. So people go back and forth, and we as Ukrainians go back and forth. But what we have realized with our colleagues, that accepting what's happening, accepting what is a very painful place, but also a very resourceful place. But you can get there only when you feel safe, at least a little bit. And this is something what many people don't have now, that basic experience of safety. I'm not even talking about emotional safety or psychological, just the basic, like physical safety. Next, please. So my colleague, she put a quote of Carl Gustav Jung, that every transformation needs the end of the world as its obligatory requirement. That means the collapse of previous philosophy of living. And to understand that, Jung was talking a lot about, it was like a metaphor, right? The end of the world. But what people are experiencing right now is actually like the real end of the world, which we will never, and they will never be able to go back to. But we still believe, first of all, we understand that the scale, the intensity of exposure to war is different among different people. Some people have been in very like in very difficult situations and have witnessed absolute extreme things. Others were physically not there, but were watching the news. Some people have already lost their loved ones. So the degree of traumatization is different, and depending on the duration, the exposure, the facts, the particular events that have happened to persons. So it's difficult to say right now how can we use this traumatic experience to help it transform into something more resourceful. But I think these are the questions we will be pondering for many months still. But people who have not experienced like severe traumas, frankly speaking, we've heard it from some clients, and we are discussing it with our colleagues, that some people in this war situation have actually rediscovered themselves. Some people have rediscovered almost like their own, I don't know whether it's meaning, or some people say that they want to change their profession. They want to do something different. Some people have said, I have never thought that, I don't know, like I want to be a volunteer. Now I want to do it definitely on a regular basis. Some people thought that, oh, I'm like so shy, I'm always so passive, but they become very active and like excellent managers in something. So this whole war experience is really, is doing a lot of things to everyone. And there are some positive things that we see, that people are, as I've said, like reinventing and rediscovering themselves. But again, I want to emphasize that it depends on what the person has experienced. Next slide, please. So the question that I've asked myself, knowing John and knowing some people from palliative care, what can we learn from palliative care community? And this is it was the moment when I reached out to John, because when we realized that what's happening is huge, the scale is very big, the traumas are everywhere, and that there will be a lot of loss, sadness, suffering, and pain, and that there will be a lot of work in terms of grief and bereavement. So I reached out to John and said, is there anything I can learn? I can do some course, or I can speak to someone from palliative care people, because you know a lot about it. I know that you are accompanying people and their families for as long as it's needed. So I thought that what also we want as psychotherapists, what we want to do, we want to become even more focused on relief of suffering and alleviation of pain, spiritual pain, emotional pain. I have like absorbed from palliative care people absolutely profound respect for people's feelings, their losses, and grief and bereavement process in general in this culture. The culture of long-term and nurturing support of people in need and their family members. Maybe we can somehow combine our efforts and do some joint advocacy for integration of palliative care services and psychological care into all humanitarian crisis situations and emergencies, to help heal the collective traumas and losses in the society, and in general, like to promote, try to strengthen and develop a culture of respect for every life and every human being till the last breath. Next, please. So as I mentioned, we have our psychology center, and we're a team of 5 people. And since the war started, we've realized that the need will be only growing, and we established it's like a separate project in our center. We decided, okay, let's run crisis center and let's offer our service for free to people who need it. So my colleagues and I, we've been offering our free sessions to people who are traumatized or affected by the war, whether they're people in Ukraine or they moved to a different country, or other people. There are actually Ukrainians overseas who have their loved ones in Ukraine, and they also struggle. So we run this crisis center offering free sessions, and the system works very simple right now. We just say, this is the phone number of our manager, just drop her a message, need help, and you will get a therapist in 24 hours. And then we have our group chat. So she sends us a message who is available, and we give a couple of time slots of our availability, and then we get connected with the client. We also ask people who would like to support our crisis center to make any donation, that we appreciate anything. And we're now busy developing our own models and structures, how to develop this crisis center and how to use the funding properly and be transparent in our work. So this is what we started doing since the beginning of the war. Next, please. And the quote that I wanted to use to end my presentation is from Elizabeth Kubler-Ross, that the most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of those depths. And from my experience of working with people in palliative care, first of all, I always loved this community, always, like from day one. I've translated a number of trainings and workshops by Frank Ferries and his team, palliative care people who are coming to Ukraine to teach this philosophy, to teach the methodology. And I've been in love with your field really from day one. So, and I was the one who was advocating for human rights component in palliative care when I worked for the Open Society Foundation. So I know that people in your industry have a lot of wisdom and skills, and you're very professional in handling this very sensitive and I would say painful matters related to human suffering and soul. And somehow you know how to do it. You have something in your spirit, you have something in terms of your knowledge, and we as psychologists would love, like, I'm reaching out now, like, what can we learn from you? How can we be of value to you? And how can we all better serve our clients and the people in need? And 100% the need will be only growing. And ideally, I think would be also to do some advocacy work so that not only the budget for the defense and military needs increases, because this is what we're going to see now, 100%. Many countries are going to increase their budget for defense. I personally would also love to see the increased budget for palliative care, for mental health needs, and for other things which are more like centered around life and people, not around killing people, but around people, to support their lives and the quality of their lives. Thank you for your attention.
And again, Mariya, again, thank you for what you're doing. You know, people in PallCHASE know I'm the chaplain. I'm always saying, don't forget the spiritual. And you just did this so beautifully, that it's not only the psychological, the emotional, but that most basic part of what gives life individually and collectively, what gives us meaning and purpose and connectedness. Ukrainians with each other that are fighting, but also for us here in the comments in the chat, how we can be connected with you and support you. So thank you so much. Without further ado, our final speaker before we joined in the panel, I'd like to introduce Stacy Remke. Stacy is a senior clinical teaching specialist at the University of Minnesota School of Social Work, teaching in areas of health, disabilities and aging, integrative behavior, mental health, and interprofessional collaborative practice. Her clinical experience includes 27 years as a pediatric palliative care social worker, assisting children with life-threatening and chronic complex conditions and their children and their families in home and community-based settings, as well as the hospital. She was a founding leader of the palliative care service at children's hospitals and clinics of Minnesota, and was one of the first pediatric hospice and palliative care programs in the United States. Stacy was a co-investigator for the NCI-funded curriculum development project, EPIC Pediatrics, and has taught the curriculum nationally and internationally. Stacy has contributed extensively to the multidisciplinary knowledge base for the field of pediatric palliative care. She has also served on the National Advisory Board for NHPCO's CHIPS Pediatric Hospice and Palliative Care Interest Group, and is a faculty member for the Center to Advance Palliative Cares, PCLC at Children's Minnesota. Stacy has served on the board of Social Work and Hospice and Palliative Care Network since 2013, and was most recently the chair in 2021 to 2022. She is a certified hospice and palliative care social work specialist and is currently working to advance the practice of social work and hospice and palliative care, which by definition in interprofessional settings. Stacy, welcome and thank you for your contributions and thank you for being here.
Thanks, Rick, and it's wonderful to see everyone here, and very humbling to follow Marta and Mariya and those heartbreaking stories of what's happening on the ground. To that end, though, I will endeavor to talk a little bit about what our psychosocial community has been working on and putting together. And with that, I'm going to share my screen. One second. We're all used to this now with Zoom, right? Okay, hopefully you can see it. I will say that this effort started by, I think, a number of people responding to Joan, people who knew Joan, people who knew that she worked in Ukraine, as she reached out to different communities. I think some of us responded and were put together. So I just want to highlight that as the power of a single person making connections. And I think this experience is teaching all of us how important it is to not underestimate the power of those personal connections and reaching out and building networks of support. I want to thank my colleague Ann Toll for this lovely poem about the value of being present to the difficulties in the world, especially we're talking about Ukraine right now, but our group is particularly interested in thinking about how we can respond to Ukraine now, and also thinking about how we can craft templates, procedures, practices that can also be implemented in other disaster areas, both natural and unfortunately man-made disasters in the world. That's my little, not advancing. There it is, okay. So who we are at this point is a number of social workers, psychologists, chaplains, and spiritual care specialists from all over the world. I think we're also gradually adding people to our team as we kind of get a little further in our work. Anne has been great in organizing Zoom meetings and bringing everyone together. I think a number of us are working kind of individually, just as interested practitioners, but also organizations like the Social Workers and Hospice and Palliative Care Network and the World Hospice and Palliative Care Social Work Group, which is quite new. The Elizabeth Kubler-Ross Foundation and others are able to engage members of these larger organizations. And I think we're going to need that kind of support. And we certainly welcome anyone with psychosocial interests to join our group. As I mentioned too, that we're all very interested in collaborating with PallCHASE to explore how palliative care knowledge and principles, kind of along the lines of primary palliative care, can be disseminated in order to better prepare people on the ground to cope with not only the needs of palliative care patients and their families, but also to think about what we've learned in palliative care about human suffering, different kinds of grief and loss, as Mariya mentioned, thinking about, how we engage people who are in the midst of suffering in the context of great uncertainty, and in the face of profound losses. So hopefully these are all organizations that work in that area and that can be engaged, and I'm sure there's others, and I'm sure we'll meet them as we go forward in this work. So the expertise that we're bringing in, I think particularly what was highlighted to us in the beginning is the overwhelming grief and loss. And I think many of us, even in just hearing the stories of Marta and Mariya, can appreciate that our sort of cognitive understanding from a distance doesn't begin to really match the level of suffering that is happening on the ground. And as we've heard in our stories today too, there's tremendous necessity to notice the intersections between trauma and grief and loss, and that the situation is ongoing. It's not over yet. I think we're dealing with a lot of ambiguous loss in that sense, that people are not even sure what they've lost yet in many cases. And so we're kind of borrowing from many theories that are out there already, and primarily using our positions of relative safety outside of the war zone and the refugee centers to try and offer support, engagement, consultation as helpful, thinking ahead too, to like crafting educational resources that can be used. What we've noticed is that those of us who've had some experience working in humanitarian crises are often struck by the fact that there's a lot of focus in the early stages on trauma. But what also needs to be thought about is the unfolding of grief and loss over time. And Mariya's also already talked about that, so that we're well aware of that need going forward, and that this is not going to be a quick fix at all. So part of that involves community organizing. As I mentioned, we kind of started with connections to Joan and are crafting now a larger network. And also kind of learning how to do that in a place where many of us maybe knew one or two people and are starting to kind of develop more inclusive networks. Also approaching this all with great humility, with the idea that really those who know best about what to do on the ground are the people who live there, who know that culture, who come from those communities. And so to offer what we know in support of what they would find useful, and to kind of sort through that as we go, just no small task. We're also very concerned about the people who are providing health and mental health care on the ground in the war zone and in the refugee centers. And as we know from palliative care, this work has an impact on practitioners, and the importance of facilitating debrief and also just making available listening ears, but also listening ears that come from the point of view of knowledge of at least part of what they're going through, can be immensely important. So we're hoping to leverage what we know about that as well. As I mentioned, we are taking a long view here. In some ways, it feels like it's taking a bit of time to get anything up and running, but at the same time, what is it that carpenters say, measure twice, cut once. I think we're trying to be careful in understanding what it is that we're trying to address, and making sure that we have adequate support in place, that we do not want to go into the situation without adequate planning and support and not be able to sustain whatever it is that we introduce. What we are thinking of right now is creating support circles, which would be informal kind of drop-in meetings for anybody, particularly health and mental health providers in the region, so that we can support their work in any way that we can, including consultation around some concepts that might be less familiar, from a palliative care context, but also from a mental health context, understanding grief and loss. We also could provide, either in the context of those support circles or maybe in specially organized ones, debriefing of critical incidents, or teams that are particularly overwhelmed, or providers who are kind of confronting some limits of their own energies. The idea being that, again, people who understand at least a little bit about their work can provide almost like a pressure release valve a little bit, and hopefully sustain them in their work. Also, we've talked about implementing what's referred to as a buddy system for kind of just-in-time support and consultation. And these would be small teams of maybe 2 to 4 people who make it their business to check in with each other, make sure that they're okay, can kind of rely on each other to consult as needed as they go. And this is a system that it actually grew out of the military, but especially during the pandemic, health systems use this as a method to kind of support frontline health workers who are, of course, under so much stress worldwide. And those providers have found it a really helpful method of obtaining support. And again, I think the theme here is that it's so important that people trust that the people that are listening to them and available to them are not going to be overwhelmed by what they're going through. That's not helpful to the person who's on the receiving end. We're also thinking about education materials. We've been asked for those, organizing written materials, education materials, educational activities, webinars, et cetera, going forward. There's some people that can make use of that now, but we also anticipate a much greater need as the situation unfolds and hopefully resolves in the not too distant future. And again, this is kind of developing it in real time, like what is the impact and need, and watching it unfold, and at the same time trying to think about, again, these intersections of trauma and grief and loss, and the cultural context and so on. And so thinking about creating templates and processes to support mental health and grief work is going to be very important for responding to humanitarian crises going forward. We'd like to have those in place so they don't have to be reinvented every single time. Again, as you mentioned, here's a timeline. Thanks to Anne for making this nice visual for us, but that we're planning to move forward with immediate needs, caring for the caregivers themselves, thinking about community crisis intervention models to follow, mobilizing communities. I think we're kind of challenged. Some of us have been thinking about this with COVID, and now with the war, it brings an additional level of urgency to the situation to think about how we scale up these kinds of supports, that it's not going to be possible to offer individual psychotherapy, for example, to everybody who potentially could benefit. But can we leverage the healing power of community and human connection to create almost systems of care that would allow more people to feel supported? I think so many people going through it together can be actually an advantage in that we can help them organize to support each other, and that shared experience actually becomes a resource in their healing. And then, as I mentioned too, we're going to be thinking long-term and creating a system of care that can be implemented following other disastrous situations. This might unfold, this timeline talks about kind of through the end of the year, but I think we expect that some level of work will be required quite a bit longer than that. We've been talking a little bit about grief and loss, but it's so important too to be thinking about trauma and trauma psychology. And there is a lot known in that, and it's kind of a world unto itself, as the grief and loss world is a world unto itself. And so bringing those things together feels really essential right now. And some of the needs that have been identified include practical help. Marta talked about that, Mariya's talked about that. Helping people find safe spaces, have food, clothing, shelter, water, those kinds of basics. In the palliative care world, the additional need to provide support for medical care that people need is, of course, also extremely important. And we don't want to lose sight of the fact that this is all happening in a war zone, and that there are things that we can do to help people sort of focus and calm right this minute to the degree that's possible, but then also to continue working on creating greater stability and safety going forward. So just to point out that there is theory, there is experience that we can draw from in this work. And our hope is that, in fact, we can support and promote post-traumatic growth, and that, we see people every day who are living through unimaginable circumstances. And I think in palliative care, we certainly have seen this over and over again in the context of serious illness. But that we've also seen it throughout human history, that while terrible things happen, there are also amazing stories about people's growth and meaning. Mariya mentioned a few of them. And so that's our hope, that we can help people find that place and that resource within themselves and amongst each other. And so that not just individuals, but the community can also grow. And I hope that our world, our society can also achieve some of that. I was just hearing someone on the radio talk about the importance of hoping that, maybe in this century we can finally get past war and try and spend our energy on things that are more humane. So next steps, we will be working to beef up our roster of volunteers, and those would be, mental health and spiritual care providers. We are also interested in identifying groups like Mariya's who are working in the Ukraine already. And we've got several links to people that are part of other networks, including a psychologist who works with the Ukrainian military, for example, and a psychiatrist here on the East Coast in the United States who's been working in trauma work since 9/11, and he's Ukrainian himself and has extensive contacts in Ukraine in the mental health community. So we're starting again to build that network. And I think both adults and pediatric providers are in that mix. And again, I think our focus needs to be on making this useful for Ukraine and the people on the ground there, and learning from them what's most needed. I think I'll stop there. And
great. And Stacy, again, thank you so much for your words. And I think we're all in this, but I know for me, it's easy to get overwhelmed with the morning newspaper and the latest news, and how you described that there is hope. And we have some tools from palliative care. And I especially love that, putting that trauma and grief together, that we do have hope. So thank you for the presentation. Before we open this up, I think we were going to have a panel, but I know, Justin, great to see you. I just want to introduce Dr. Justin Baker from St. Jude's Children's Research Center. He's the Chief Division of Quality of Life and Palliative Care and the Director of St. Jude's Global Palliative Care Program. Justin, do you want to just say a few words, add to this before we open this up? Welcome.
Thank you so much. Yeah, I think this has been an incredible event together, and something that Stacy brought up, and I'm sure was started at the beginning of this is I think one of the most important things is this collective experience, and there certainly are those that are experiencing this very differently. Our Ukrainian friends, and Mariya, you being right there in Kiev is unbelievable and very difficult to even imagine. I do want to say that it's been incredibly inspiring this time, but also throughout the entirety of this war, to see the community come together. I want to again label that, Joan, your energy, enthusiasm, your daily Facebook firestorms of prayers and encouragement and unity and bringing us all together are just so inspiring. And for those who are in Ukraine, continue to be in Ukraine, both practicing medicine and those who are really, providing critically important psychosocial, spiritual, holistic care. I just can't imagine what that's like. And somehow we as a community want to take part of that weight and help. One thing that I would want to say out loud, and I'm speaking for Marta, even though Marta's back now. One thing Marta told me at one point, and this was actually very helpful for me to understand as well, is sometimes when we're on the outside trying to help, we provide all of this stuff that we think is helpful, and it actually can be somewhat overwhelming. We had one email that turned into about 40 responses and maybe 250 pages of documents and all of this huge repository, and it ended up being overwhelming, not very helpful. So I think we have to have an ear to what it is that people are asking for, be fairly direct in how we respond to that, and also be kind of humble and realize that perhaps we may even add to some of the stress by trying to kind of meet our own personal need of making a difference. So I've learned that so far through this experience.
Thank you. Wise words. And I know Joan is here with us. She has a little cold and a little laryngitis. So I kind of jumped in and to take over some of the chairing role. Megan, you're also here. Do either one of you have anything to say, or should we open it up?
Thanks, Rick. And as you say, I don't have much of a voice at the moment, but I think that just being here as a community together is so hopeful, and that I know that whatever develops from the work that's being done now can be expanded, and it can reach into other humanitarian crises as well. So I just want to say thank you to all who are doing so much.
I think I echo those sentiments. We're really here as a group of professionals and people who've had experience, many of us in humanitarian settings, recognizing that every crisis has its own unique challenges and experiences, especially for those who go through it personally, but that we want to be here and walk with you as much as you need us to be with you. So I think the best would be for discussion, and I know many people may have things they want to share.
Brilliant. Thank you. Thank you both, Megan and Joan. And so if you look on the bottom of your screen under reactions, there should be a little raise hand. I think for me, you're all on one screen. So if you raise your hand, I will call on you. You can unmute yourself and contribute to this very, very global conversation.
Maybe I'll start things off with a question for Marta. I know you mentioned that you guys were really focused on children with cancer, but also I did see a bit of a broader mention of children with other sort of serious or life-threatening conditions. And to what extent have you seen those children coming out of Ukraine? Many of them are on like tons of different medications, if you think of like the complex children that we care for, and just wondering like if you have any additional comments about how they're faring. I know some of them have been shifted to Romania and Germany and stuff, but just to give us a bit of a sense of how their experience has been.
Of course. So our scope, and it's really from a purpose of safety, because if I had to take care of a heart transplant patient, that really would not go well right now in my life. But our scope of care is pediatric cancer, blood disorders, and catastrophic illnesses. And so the first group that immediately comes to mind are patients with immunodeficiencies, for example. However, we don't turn anyone away. And so this doesn't happen as often, but early on in the crisis, we would get calls about heart transplant patients or patients with kidney disorders needing dialysis. And so we would have them come to Poland through our mechanisms. Because we established a safe humanitarian corridor from Lviv to the Polish border, and then on ground to Poland, Germany, Austria, or the Czech Republic. And so there's definitely mechanisms for that. We have a very large international network. And so, for example, today there's a premature infant who was born at 29 weeks with family in Canada. And so we connected them with Sick Kids, and Sick Kids is going to see if there's any possibility of reuniting that family with the premature infant who's in a Polish center now to Canada. And so we're open to helping whenever anyone asks us for questions. And we've also shared some of our materials in terms of our policies, our processes, the mechanisms for which we collect demographic information, how our Excel spreadsheets are structured with other pediatric subspecialties in Poland, so that people don't have to spend time reinventing things that we've already done. And so there's definitely efforts similar to what we're doing. And we collaborate when we can, especially with the safe transport mechanisms, which take a lot of collaboration between the Ukrainian government, the Polish Ministry of Defense, and the Polish Ministry of Health.
Great, thank you so much. Other comments or other questions for any of our speakers?
Rick, I wonder if you would just point out that Anne has put in the chat a link for anyone who would like to join the coalition.
Yes, Anne has put in, thank you, Anne, for putting that in again. If you'd like to join the psychosocial curriculum, the psychosocial group that we're trying to put together, that Anne talked about, and so did Stacy. And I know Megan will also put in a link for joining PallCHASE if you want to get on our mailing list, if you want, more information about other webinars that we're doing. So great. Thank you.
Rick, I'm going to also put in a link to our global education series. We have one coming up on Tuesday of next week, which is very relevant as well, which is on grief and bereavement. And Ulrika Kreiksberg will be speaking at that. And so I'll put that link in the chat as well. And everybody's welcome.
Other comments or questions, reactions? Ruth, I see a hand, and then Mariya, I'll go back to you. But Ruth, go ahead.
It's just a very practical question for Marika, really. Just, is there anything, there are lots of us who are nurses and doctors here who are with practical palliative care skills, and I just wondered if there was anything very practical that we could offer you or palliative care in Ukraine.
Thank you. Mariya, responding like immediate, you shared some on, and we'll share that information to all of you that registered the slides. But Mariya, any other practical things about how we can support you and the soul?
Thank you, Rick, and thank you all very much. And I wanted to echo what Stacy said, that it would be great to create some kind of systems, processes, and templates that other countries can use. And having worked in international development for some time, I also understand how valuable might be the crisis in one place, but the lessons learned that later can be applied in other areas. So I just wanted maybe to use an opportunity to say that I'm happy to make whatever I can and we can as a team to help other countries across the globe to deal with their challenges that they might face. And I wanted to mention, when we were trying to structure the needs of different people, I just want to mention like 5 bullet points, how we are looking now at the groups in Ukraine, and maybe it will be somehow helpful to you to also understand the needs of people in palliative care. We look at people, those who stayed in Ukraine, where they lived before. Like, I'm from Kiev and stayed in Kiev. It's one story. This is group number 1. Then the second one, the second group is internally migrants. Like we've mentioned that things in the east and in the south are very bad, and we can see a lot of migration from the east and the south to the northern part of the country. So it's probably more. There are more questions to our national public health system, but still this internal migration happens, and definitely it's bringing out a lot of questions in terms of palliative care and also different psychological issues. The third group we've identified for ourselves as practitioners, people who lived or live on the temporary occupied territories. So these are the territories in Ukraine which are already occupied by the Russians. Also, things are working there very differently comparing to other parts of the country. Then group number 4 we have identified is people who moved to a different country. Sometimes they moved on their own. Sometimes they had to leave their elderly parents or someone behind in Ukraine. Sometimes they could move all together. So also a lot of questions, yes, people will have to deal with those who moved to a different country. And another actually big category is people who are experiencing forced deportation. It's happening mostly in the eastern part of the country, and people, it sounds really crazy. This is like 2022. We're really having almost, very often we have the feeling that this is like World War II. But really people are really now forcefully moved by Russians to some very remote areas in Russia. So sometimes it's only children, sometimes it's women, sometimes it's men. So this is another group of people, and how they're going to live their lives. And the Russians take away their passports. They give them some kind of ID document to allow them to live in Russia, and they force people to sign the papers that they're not allowed to leave Russia, at least for 2 years. So there will be lots of questions also about this group of people.
Thank you.
I'd just add that in terms of the question about practical assistance, something that we've been talking about is awareness that there certainly are groups that are very experienced in taking healthcare into humanitarian settings. Doctors Without Borders and Project Hope and others. And I would encourage people to look into volunteering with those groups if you'd like. What we've heard overwhelmingly too is the need for supplies is great, and therefore funds to support getting those into the proper hands is another way to be of assistance right now, at least practically.
Thank you, Stacy. Marta.
I think something practically that I would find helpful to share with our collaborators across Europe and North America is just a description of what a normal, experience in the medical system in Ukraine would be. For example, one thing that I learned is that a Ukrainian family going to a country in Europe was nervous or thought they were treated as second class, seeing a different doctor every day, because these families were used to seeing the same doctor every day. And so that was a difference culturally. Of course, they weren't being treated as inferior or different. It's just a different approach. And so description of the common experience of a patient in Ukraine, and then some of the cultural nuances that are the must need to know for physicians or any type of clinician that's taking care of these children, and some of the contextual factors to consider. Because I think this information would I think the care that they're receiving right now is wonderful, but we could even enhance the experience further to make it more personal. and more attentive to the needs of these patients and families. If there's something like this exists, please let me know, but I haven't come across it yet. And it's not something, it's on the back of my mind to develop, but I haven't been able to get to it yet. I would find that wonderfully helpful.
Great. Thank you. Thank you, Marta. And Mariya, your hand is up again. Nope. Okay.
Sorry, Rick, and Megan's put in the chat the link to the Global Giving Appeal that can be reached through our website, WHPCA, ICPCN, and the, sorry, I've lost my voice. You'll have to read it. The Elizabeth Kubler-Ross Foundation.
Great.
Yeah, so I can just say that that group is coming together, the Worldwide Hospice Palliative Care, ICPCN, Elizabeth Kubler-Ross, and PallCHASE. You know, we're all working as a group to support palliative care and raise some money to support palliative care in Ukraine. We're very connected with Ukraine over many years, mainly through Joan, but you know, we've all had that connection. So that will be something that you're welcome to support. And again, if you join PallCHASE, you're going to start to get a lot of emails, information from us about ongoing efforts and activities that we are starting as we sort of have embarked on this journey of listening and understanding, and then going forward. Similar to how the psychosocial group is working, there will be other groups starting like that in various domains.
Okay. Brilliant. Others? Anne, any comments?
I just recalled that Joan has a talk coming up on 5th of May, but I can't find the link. 5th of May, there should be some link or flyer somewhere.
Find it and post it. I think I have it somewhere.
Yeah, it's the global lecture in Friedrichsdorf.
The other thing that I'd like to affirm, and thinking about clinicians in Ukraine, and if it could be helpful and if travel is possible, thinking about Rome or thinking about the Marta Foundation conference, if there are people that need scholarships to that or other opportunities to come together as a group in that way, maybe that's nice too, as we could provide hopefully some enthusiasm, encouragement, safe space, and love and light. And so I think we certainly here at St. Jude would be very happy to partner in order to help with things like that. And so Megan and Joan and Rick and everybody here, as you guys are coming in communication with people, if that's of interest to them and funds are not otherwise available, we'd be certainly happy to help.
Great. Thank you, Justin.
Yeah, that's wonderful, Justin. It would be wonderful to get some of our Ukraine colleagues there. And we will be having a special session just around issues around Ukraine.
I also want to take the opportunity to mention, in addition to what Justin shared, is that St. Jude Global is also working with the Safer Ukraine initiative to develop a web series called Safer Conversations. And so they're bringing together partners as well to address topics that are identified by our Ukrainian colleagues. And so hopefully we'll be able to share. We had our first session last week. And so it'll be a series to follow, but we will also share that information when it's available.
And we will send out a summary of the webinar, which will include all this key content that's being shared in the chat in case you haven't managed to catch all the links for all the things that are upcoming.
Thank you. Thank you for putting those links in there. Okay. Any final comments, questions? Again, on behalf of all of us at PallCHASE, we thank you for joining us today. It's been great. Wilson, I believe Wilson has asked Marta, can you give us an email for Marta? So Marta, if you want to, I know you can put that in, or you can, I'm sure you can contact Justin. Oh, there we go. Thank you. Sorry, trying to talk and read chat at the same time. But again, thank you all for joining us. It has been great to have you. We at PallCHASE are very committed to this. We will, as Justin mentioned, we're going to have a special session at the Vynnytska meeting in Rome at the end of May on this, that we can continue. There is a Facebook page that we are putting up with some resources. So feel free to jump in to join us, on the Ukraine, on PallCHASE. But we thank you for your passion. And especially for you, Mariya and Marta, and also Stacy, thank you for your input. Mariya and Marta, thank you for your work. And please know that, at least for myself, every day you are in my prayers, good thoughts, blessings for your safety, for your well-being, and for your soul, Mariya, as you care for other souls, that we care for your soul in any way we can.
Thank you, everyone.
Thank you very
We'll
much.
have a recording link to share very shortly, and thank you for joining.
Thank you very much.
Joan and Rick, if you want to just stay on, we'll